Greetings everyone, this is me, Dr. Atit Tiwari, and today we'll be talking about behavioral changes. This topic is equally important for the doctors who is preparing for USMLE, PLAB, as well as for the nursing students who are preparing for NCLEX examinations. So, understanding about the topic, it's more like whenever a person has to adapt some behavioral changes. For example, if a person is a smoker and if he wants to change, if you as a health professional want the person or want to help the person to change his behavior and quit smoking, then oftentimes you find the patients will be in one of these 6 stages, and so you counsel accordingly. You try to identify which stage in the behavioral change pattern is the person in. So once you identify, you counsel the person accordingly, you help the person accordingly so that he can sustain quitting the behavior of smoking, quitting. Okay, so it's more like as a physician or as a nurse, you have to try to understand which stage in behavioral change the person is in. So, and then you start counseling or start supporting the patient, your patient accordingly based upon that stage in his behavioral change, so that he can sustain and he can really achieve quitting of smoking. So, well, we'll be talking about this topic. If you feel the speed is slow, you can increase the speed. If you feel the speed is high, faster, then you can lower the speed. Okay, it's in YouTube, so you can take the benefit of that. Now, so here basically we call it Transtheoretical Model. So here we have to move through. We have to know that there are 6 stages. They are either pre-contemplation. In this stage, the patient is not ready. For changing the behavior. Let's say smoking. He's not ready about quitting smoking. Okay, and at the same time, next is contemplation, in which the patient is thinking about it, and in the next phase it's preparation, where the patient is planning to quit smoking. Let's take smoking as an example here. And again, action, he is actively changing and in the process of quitting smoking. And it's maintenance, he is sustaining the change. And in the relapse, we call, if in any case the person, after going through all these phases, if he starts smoking, then we call it as a relapse. So the person who is in the process of changing his certain behavioral, let's say quitting smoking here, then he will be in one of these 6 phases, and we as a clinician so identify which phase he is in, and then provide support accordingly. So we always say it is a dynamic journey, because you have to move from one phase to another phase, and it's not a singular event. Okay, and at the same time, at the same time, as I said earlier, we have to know which phase he is in, so that we can intervene accordingly. As different phase, different stages, has different approaches, different language we as a clinician must use, and different goals to move forward. Okay, now let's deal with each one of them properly. Now, stage 1 is pre-contemplation. So in this phase, the person is not ready yet. In their mindset, in the patient's mindset, he will be like he will deny health risks or feel that quitting is impossible. Often he becomes defensive when the topic is raised by others. Okay, for example, in terms of smoking, the patient will be like, I don't really think smoking is a problem right now. I have been doing it for years and I feel fine. People keep telling me to quit, but I'm not sure I want to. So this is what the person is feeling inside, and what he says to you if you ever start the topic of quitting smoking. So when the person speaks in this tone, in this voice, then we understand that he is in pre-contemplation stage. And at this point, now since you identify he is in pre-contemplation stage, now you as a clinician, your goal must be to increase awareness without any judgment. Okay, increase our awareness about quitting smoking, benefit of quitting smoking, and you must never judge the patient. And your sentences can be, or your words can be like, I understand you are not ready to quit smoking right now, but I'd like to share some information on how quitting can quickly improve your present condition. Let's say he has a problem with breathing, so your breathing and energy. So in this slide we understood what is pre-contemplation, how do we identify what the patient will be telling you, so that you can judge, so that you can interpret that he is in pre-contemplation phase, and then what your goal must be and how do you respond. Now similarly, sometimes the person who in your clinic will be in contemplation phase of behavioral changes. Let's say here again quitting smoking. So how do you know that he is in contemplation phase? In this phase, the patient's mindsets will be confusing, ambivalent. He recognizes both pros and cons of the behavior, but he is uncertain about taking action, because he says both the pros and the cons of the behavior. He likes, understands what are the benefit of smoking. He also understands benefit of smoking for him, like it gives him concentration, something like that, and also he understands what are the cons of the behavior, like it can cause cancer, but he's somewhat in confusion. Okay, so and he's uncertain about taking action. So this phase is contemplation phase of behavioral change. The patient will say, like, I know smoking is not good for me, I cough more lately, and I am starting to wonder if I should quit, but it feels hard and I'm afraid I'll fail. Okay, and as a clinician you must say, like, give them motivation and by exploring reasons why quitting matters personally, such as, okay, if you quit, your health will get better, your family connections, your family will be more happy with or with you, there will be less family quarrels, it has also financial benefits. So yes, you have to, these things must be your, as a clinician, these things must be your goal when you try to coordinate with the patient. And you will be like, example, you'll say to the patient that it sounds like you are thinking about quitting. That's a great first step. What benefits do you think you'll notice most if you stop smoking? So in this way, you are trying, with these questions, you are trying to motivate the patient to find his personalized benefit, what he feels it. Okay, but he's trying, because he's confused, right, whether to continue smoking or to quit smoking. He understands quitting is better, but still he thinks that he may not be able to quit. So at this time, when you understand that this person is in contemplation phase, you will try to understand what can be the best motivation in this person. So you try to say that, what benefits do you think you will notice most if you stop smoking? Now when he says, okay, I think if I quit smoking my health gets better, then you can just target on health sector more, health benefits more, while you move on counseling the patients. And similarly, if he says the financial thing, then you can say, yes, you can talk more about saving. So we have to identify this contemplation phase too. And similarly, sometimes the patient will be in preparation phase. I mean, he understands the demerit of smoking, and then he will try his preparing to quit the smoking. In this phase, the patient's mindset will be like, he's gathering some necessary resources and support system so that he can start quitting the smoking. And the patient will tell you, like, yes, I have decided I want to quit. I will pick a date next week, doctor or nurse, and get nicotine patches. I'm telling my family so that they can support me. So in this phase, the patient is preparing, but he has not started quitting smoking yet. Okay, and as a clinician, your goal must be to help create a concrete, actionable plan. Okay, you can help the patient to set a specific quit date, like, okay, your birthday, that's a very good, your child's birthday, your anniversary. This can be a very good timing to quit smoking, so that it inspires him, it motivates him to continue quitting the smoking. And you can also talk about the trigger factors, and also help him to connect to a social network of let's say quitting smoking. And as a clinician, you can say that, since you are planning to quit soon, let's set a quit a date together and discuss ways to manage cravings, like nicotine replacement or support programs. Okay, so the patient is trying to quit, but he has not yet started quitting in this preparation phase. So you, as a clinician, will try to help him to set a date, as well as provide support system, because you are more knowledgeable about support system, and you counsel about the nicotine replacement therapy. You counsel about there are different support programs by local communities, by anonymous groups, by online platforms, and you provide those resources to the person so that he becomes much more prepared and much more motivated and much more supported. And next phase is the action phase. In this phase, the patient will be have already started quitting the smoking. He hasn't been smoking recently, and the patient mindset will be like he is experiencing both challenges as well as victories. So since he is quitting smoking recently, let's say for 2 weeks, so he has something to say that, okay, yes, I'm feeling victory, and at the same time also like it's so difficult for me sometimes. So he has been experiencing both challenges and victories in this action phase. Okay, and so in this phase, as a clinician, you have to help him maintain commitment, help manage any withdrawal symptoms if he is developing, help reinforce daily successes, and provide practical coping strategies for high risk situations and cravings. So again, in this phase, the patient will be like, I quit smoking 2 weeks ago. It's tough, but I'm using gum and keeping myself busy. I feel proud when I make it through a craving. So in this phase, again, the action phase, the patient will be telling that he has quit smoking for a certain time, and he has something to tell about his experiences as well as experiences regarding the victories, the how motivated he is. But at the same time, he will tell about the challenges. And it's a as a clinician, your goal is to maintain, help the patient to maintain commitment. And if he has any withdrawal symptoms, you try to navigate through the withdrawal symptoms and try to help them too. Again, you can tell that you have already quit. That's excellent progress. Just stay consistent with the strategies and use a support system when you feel tempted. So this is just an example how, as a clinician, you can frame your words to the patient with all these clinician goals. Now, next phase is sometimes the patient will be in the maintenance phase. So the maintenance phase is like now he has already quit smoking for more than, let's say, 3, 4, 6 months, and now he is maintaining it. So in this phase, the patient's mindset will be like, he will try to prevent relapse. Now he'll try to prevent relapse, and he'll try to strengthen new habits upon himself. And since now, if he has already quit smoking for, let's say, 6 months, then he has now that confidence within him to deal with the craving and to deal with the triggers of craving too. So as a clinician, when a person comes into your clinic and says that, okay, he had quit smoking 6 months ago, and now he feels much more confident with quitting smoking and dealing with the trigger factors, and when he tells such things, then as a clinician, you must continue supporting him, help if he talks about finding difficulty with avoiding specific triggers, then you must try to help him as your competence. You must try to help him identify that trigger and try to avoid that trigger. And also, you can always celebrate the milestones and reinforce that the benefits they are experiencing from the change. Okay, that's gonna, like, you can say that, okay, oh, it's wonderful you have been quitting smoking for the last 6 months. Do you feel anything that triggers you for occasionally? Then if he says yes, you try to deal with that. If he says no, then that's very good. You must really celebrate these things with your family. You can go out with your family, with a daughter, and you can celebrate this, maybe going to Disney, something like that. And also you can always appreciate the changes that, okay, now see, even your X-ray looks better, or your symptoms your difficulty in breathing has subsided. So these are really good. You must keep it up. So these are the things as a clinician you can tell to the patient. Okay. Yes. Here is an example response that I have written. You have maintained your quit status for 6 months. That a major accomplishment. Keep focusing on your health and positive changes you have noticed. How are you during situation that is to trigger smoking? So this is again as a clinician, is an example as a clinician how can phrase your words to the patient. Okay, now yes, and now the patient is, sometimes the patient will be maintaining, but sometimes the patient will come to your place and says that, oh doctor, I had been doing quitting smoking for the last 6 years months, but suddenly I have gone into the relapse phase. So suddenly I have restarted smoking. So in this phase, patient voice will be like, I slept and smoked. The patient will tell you like, I slept and smoked at a party last night. I'm disappointed, but I don't want to go back to smoking regularly. I'll start quitting again from tomorrow. Or yes, now when the patient says you this thing, you have to understand that now he is in the potential of going back to the relapse phase. Okay, so you have to reframe the patient from going to the relapse phase, and you also have to understand that relapse is always a normal experience. Most of the people, they go to the relapse phase. So, and then it's expected in behavioral change. Relapse is expected. So in this phase, you must not demotivate the patient. Rather, you have to help the patient to identify the triggers, what circumstances lead to the relapse. Okay, and adjust the strategies so that he could develop coping mechanisms for next time, and also help him to rebuild the confidence that, okay, so here you have to emphasize the past successes and renewed commitment. For example, if the patient says, last night when I met with the friends and my friends took me to the pub and then I could not resist myself, then maybe you tell that, okay, from the next time when you go to the pub, you may take the nicotine patches with you, or you may just develop the habit, or you may just tell the friends that I will be going with you, but please don't force me to smoke. I have really great health problem. I'm really trying to recover. Maybe your friends will understand. So you can adopt these techniques from the next time. Or maybe if your friends are too pushy, you may try to avoid such friend circles for a certain period of time. Okay, so this is how you try to counsel the patient if he or she is in the relapse phase. Again, you can say that it's a patient as a doctor or as a nurse. You can counsel and you can use these phrases like, it's normal to slip up. What's important is learning from this. What triggered the slip? Let's plan to handle similar situation next time. Okay, so you must always understand that relapse is a normal thing too. It's always expected. A person who has been going through all this pre-contemplation, contemplation, planning, action, and then maintenance can always, or most of the time, go through the relapse phase, and this is expected behavioral change. But if you can help the patient again to quit smoking and go back to the maintenance phase, then it may happen. You may have to do this twice or thrice, and then the person at a certain period of time can really adapt that new behavioral change and really quit smoking. So this is a really important topic, and sometimes it's confusing, but it's always good to always link it with one example, and so that everything stays in your mind and you can prepare for your examinations. So in examinations, the questions will be like, the person will be this and this. It's more like the person will say this and this. So which among these options would you choose? Will you choose, so that in order to counsel a patient? So there will be 4 or 5 options, and then through the question you have to identify which stage in behavioral change is he or she in. Then you have to pick one of the options that best as a clinician that best supports in behavioral change. Okay, so yes, I hope this presentation is helpful to you. You can always comment so that more people get to comment upon your views, and if possible, I'll also comment in your views, and always share, and subscribe the channel for more videos. Bye bye, see you in next video.